And thank you, Alison. That was a terrific overview of so many problems in nutrition. I'm just going to speak about one particular nutrient, vitamin D, and you've given me the interesting title of The Debate. I'm going to suggest to you that there are many, many debates about this one little nutrient, vitamin D. There are so many different opinions, and much like Alison's talk, really, there's a lot of politics, there's a lot of opinion, but there are also plenty of facts, and I'm going to try and give you some important facts to help you make your mind up which side of the debate you want to stand on. I'm hoping you're going to continue to interrupt with comments and questions. I've got about half an hour worth of speaking to do, and I think there is time for about 10 minutes of questions, which we can take as I'm going. I'm not here this afternoon for the panel, so I'd appreciate your comments and questions, and after me there's a coffee break when I'd love to talk more with all of you, because to me this is a very impressive audience. I'm very keen to meet people who can change the problem that I face as a doctor. I work at the Royal National Orthopaedic Hospital. Actually, I meant, where's my pointer? Here. So I work not far away in Stanmore, and I've just noticed we have one of our brilliant children's nurses, Jill, over there, who can tell you all about it. If there is time in the middle of my talk, I'm going to do a short commercial break about the great hospital where I work and tell you a bit about what Orthopaedics is. Does anybody here speak Greek, by the way? No? No? Good. I can tell you what I think that word means in Greek then. But it's basically the bone hospital, and I see children with rickets, which I think is totally unacceptable in this day and age, and that's why I'm here. So if you don't have time to interrupt me for any questions or comments or ideas, there's my email address. I think you're here for many reasons. Some of you may not be interested in vitamin D at all, but those of you who are interested in vitamin D may have become interested only over the last year or so, and that may well be because of this little baby who sparked a very big debate. But there are many debates about vitamin D, such as how much vitamin D do we need? There is no agreement within this country, and certainly not between this country and other countries. How should we get it? I'm going to talk a lot about, should it be free? Should we give it to everyone free? Is it a drug? I mean, in this country, all children get all drugs free of charge. But is it a food, in which case perhaps not? Does the dose depend on how old the child is, or how big, or what their racial background is, or where they live in the country? Those might sound shocking, strange questions, but those are questions which are seriously debated in government and elsewhere. What's the blood level of vitamin D that we should regard as normal? And what even does that word normal mean? In the vitamin D field, there's a lot of debate about what is normal. Is normal what the average of I mean, you guys look fairly healthy to me, so if we measured all your blood level and we found out what the average is that sort of normal? Or no, if we compared you with another country where they have, like America for instance, they have higher blood levels and they perhaps are healthier in some way, should we be aiming to get the whole population up to a certain level? Do we define normal about what we see nowadays, or what we used to see, or what we want to see? Big debate. Is it safe? If people like me are campaigning for a bit more vitamin D to be given out, that may help some children, but will it harm some others? And a big question for people like me, I don't think, are there any paediatricians here? No? Any doctors at all? Hello. I've got one friend. But for paediatricians, I think one of the hottest questions that we're struggling with at the moment, can a low level of vitamin D cause fractures? And does anyone know the name of this little baby? That's Jaden. Jaden Ray died 3 years ago. He went to 2 excellent hospitals not far from here and was found to have many medical problems, including many fractures. So he had many broken bones. And initially, it was pretty clear that he had suffered those fractures as a form of child abuse, and his parents were arrested, He died in 2009, and last year the Old Bailey Criminal Court decided there was not enough evidence to convict them because at the post-mortem they found that he had rickets, and that raised the whole question of, if you have rickets, can that explain the fractures, or is it still child abuse? I was not involved in this case of rickets at all, and as far as I understand, that debate still rages. There are some paediatricians who still think this was child abuse and rickets. He certainly had rickets, but whether that explains everything or whether it's child abuse is a very difficult question. Anyway, I think some of you may be in the room, and certainly I'm in the room, I know, because of this baby. You wouldn't have invited a paediatrician to talk about vitamin D. Paediatricians were not very interested in vitamin D. But this year, we've all become very interested because of this little specific question. So the Old Bailey released the parents just before Christmas, and that led to a massive media interest in vitamin D. And I got to be on television, which was great fun. And then in just after Christmas, in April, in fact, this year, the civil court decided to give these parents their next child back, because he died in 2009. The next year, they had a little girl who was immediately taken into care because the parents were thought to be a danger. But the civil court this year decided it didn't even meet the balance of probability. So even on a 50-50, there was not enough evidence to suggest child abuse, and that hit the media again. So that's a bit about what doctors are interested in. How much vitamin D do we need? How should we get it? Alison has mentioned this already. The National Diet and Nutrition Survey gives us some idea about what is normal. By the way, I have taken out and added a couple of slides. You may have noticed, those of you who are looking at the papers. So the top, and I've changed a bit of them. Anyway, you've got these numbers are written down on your handouts. So last year they reported that toddlers, about a quarter of toddlers, do not seem to take enough vitamin D in their diet. And they've also measured blood levels on teenage girls, and that showed that the average blood level is 42. Do any of you know what sort of blood level we like people to be? Anyone want to shout a number? No, you may not be. So there's a big debate about the level. 80 in America, and there are some people in this country who also believe you want quite a high level of 80. In this country, most of us conservative British people say 50 is fine. But everyone has agreed that if you're below 25, you are deficient and you're at risk of getting a serious complication such as rickets. And we did a study in our local District General Hospital down the road of 346 pregnant women. It's about to be published any minute now in that journal. And basically we found that a third of them were deficient, that is below the level of 25, which everybody would agree, even the skeptics. There is no debate about the fact that you want your blood level to be above 25, and a third of pregnant women are below that. So that sort of data is literally just coming out as we speak, and that will inform some of the debates, which at the moment are based on a bit too much opinion and not enough data. Can I just ask you for your opinion? Do you think in this country the average toddler gets enough vitamin D in their diet? No. No. Good. What about this, though? Can I just ask first, for a show of hands, before I show you the next question, who here is a midwife? No, I'm only joking. I'll put my hand down. Okay, so, and who here is a health visitor? Training. Okay, so who is, can I start again? Who is a midwife or training to be a midwife or in that sort of field? Okay, and health visitors, there's more health visitors. And I know there are various other people, nutritionists, and there's a doctor and dietitians and so on. Okay, I thought there were more midwives than health visitors, and I was a bit nervous to ask the next question. My wife is a midwife, and she's probably going to come through that door any minute. And, so who thinks that breast milk is a good source of vitamin D? I'm putting my hand up again to trick you. So, okay. I'll come to that. This lady is suggesting that if the mother is taking it, and right at the end I'm going to show you some data just published from America. If the mother is taking a lot of vitamin D, then the breast milk is a good source. But in this country, most mothers don't take much, and the recommended amount. Do you know? I mean, the dietitians and nutritionists will be good at numbers. I mean, how much vitamin D is a pregnant woman recommended to take in this country? 10 micrograms, and people like me don't tend to talk in micrograms. The dietitians and food people talk in micrograms, and we talk in units. Anyone want to shout out how many units is 10 mic? So that's all. Those are micrograms, and 10 micrograms is 400 units. It's fine. You can talk in micrograms, and there's again, I'll show you some of that towards the end. So that really is news, though. Most of us thought that breast milk was perfect until a few years ago. Until very recently, it's been very difficult to even stand up before any midwives and suggest that if you're breastfeeding, there may be anything lacking in the breast milk and that the mother should take some vitamins or the baby. But we have learnt that you do need to supplement breastfed babies. So the things that I would like to talk about, I don't need to talk about all this. If you want to interrupt me, we can work our way around it. But I'd like to say something about what is vitamin D, what are the sources, where do you get it from, how do you define deficiency, how does it present? In other words, if a child has vitamin D deficiency, what makes them go to the doctor? So there's a few reasons. I've mentioned rickets, but there's other things that children might come to see us about. Why is it recurred is a question that really bothers me, and it's, again, it's all along the lines of what Alison was talking about diet generally. We used to be quite healthy. Well, 100 years ago, rickets was quite common in London. Then it was abolished, and people had really quite healthy vitamin supplementation in this country. But recently, we've lost it again. And I think probably the most important thing I need to get across to the midwives and the health visitors and the dietitians in the room is how do we prevent vitamin D deficiency? Doctors are interested in diagnosing the kids who get rickets and treating them. It's very interesting, but it's really much more important for you guys to prevent it. I'll say something about is it safe and about the future. So what is vitamin D? Well, it's a chemical that looks like that. It's a biochemical. And it's something that a vitamin is something that you need in tiny amounts in your diet, which is a biochemical. It's not a little element like cesium or zinc or something like that, but it's a complex chemical. This is a steroid type of chemical based on cholesterol. This chap got the Nobel Prize for discovering its structure in 1928, but it was already known about 1900 that if you gave children cod liver oil, you could prevent rickets or you could treat rickets. So they knew there was something in cod liver oil. He worked out what it looks like. I want to say a bit more about the chemical in a minute, but first, can I just ask you to shout out some good sources of vitamin D? Where do you think... actually, can I first ask you one other question? Who here is taking vitamin supplement? Who takes quite a lot, so maybe almost about half of us. But let's leave out the supplements for the moment. For the rest of you, where do you get your vitamin D from? You don't think you need a supplement, clearly. Ah, thank you. Anything else? Great, great. I think I heard a few more people say sun, 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 and that is the natural source of sunshine for the rest of you. Yes, I heard some eggs, and somebody, I'm sure, would have said fish. Mushrooms, if they've had sunshine or they've been irradiated, mushrooms will have vitamin D. Or foods which someone has added vitamin D to. I mean, formula milks, of course, and some cereals. But you want to look at your cereal packet. A lot of Kellogg's cereals are becoming vitamin D supplemented, but a lot of them at the moment have other vitamins but no vitamin D. But, I mean, Alison pointed out that people are eating very little fish in this country, and what we would regard as a normal diet would not have enough fish. The natural way to get vitamin D in this country would be sunshine, and the problem is there just is not enough sunshine. In the winter, you simply cannot form any vitamin D in this country. I'll come on to that in a second. Just say something else about the sources. In America, it's different. They supplement most of their milk and orange juice has vitamin D in. Not so in this country. Milk and orange juice in this country does not have vitamin D. So milk is a very good source of calcium, but not vitamin D. So sunshine, I could talk for half an hour just about sunshine. All I'll say is that there's a particular type of UVB that you need, and in this country, in the winter, the sun does not go high enough in the sky to form any vitamin D. So if you stand outside naked all winter, you will get cold, but you won't get any vitamin D. Just say something about how vitamin D works. It's basically a precursor to hormones that the body needs to function. So vitamin D itself doesn't do anything in the body. And I'll just show you that on the next slide. Basically, if the sun shines on your skin, you convert 7-dehydrocholesterol into vitamin D. But that doesn't do anything. And if you eat vitamin D, it doesn't do anything physiologically in your body until the liver converts it to that and the kidney converts that to that. It's 1,25-dihydroxyvitamin D2, which is a very active hormone that controls your calcium and does all sorts of important things. And the reason why I think that's important for us all to know is if you're worried about overdose, don't. Overdose of this really has very little effect because your liver doesn't convert it and the kidney doesn't convert that. So if you take a massive dose of vitamin D today, you'll just store it, excrete it. It won't do anything. Your liver and kidney will slowly convert what you need. And that's a very important safety mechanism. I think I'll skip over the next slide briefly. Just, I mentioned that there's... Sorry?
Did you say you can't overdose on vitamin D?
I effectively... Well, if I said that, I shouldn't have put it as bluntly as that. You can overdose on it. And again, towards the end, I'll quickly show you some evidence of overdose. But I'll say that overdose in vitamin D is extremely rare, and the reported cases in children have all recovered, except perhaps for 1 or 2 children who died. But that is ever in the whole world. So it's extremely rare. Vitamin A is very easy to overdose on, and there's many deaths and complications. Vitamin D is the opposite. I would say it's very safe. But again, one could talk about that for an hour. I just explained that vitamin D is converted in the liver to that, which is converted in the kidney to that. And I've noticed that I've called it out there simple vitamin D, which it is the stuff you buy in the health food shop or they put in the cornflakes, is generally people call it simple vitamin D. And it reminded me of what Alison was saying about simple obesity. And that is such a mistake. There is nothing simple about the management of obesity, as you pointed out, nor is there anything simple about vitamin D. And I think that word simple we probably should take out. The more I learn about vitamin D and the more I deal with it, you can study every single aspect of it, and it is not simple. But basically, that stuff is safe, I would say. Yes.
And all the food stuff.
Yes. The other 2 things you can't get hold of. So I'll just quickly flash this up for the doctor because she can prescribe particularly the bottom one, and it's called calcitriol, and that is very powerful. That's the stuff you do not want to overdose on. That stuff. Take double the dose of that and you will be ill. Take 10 times or even 100 times the dose of that and you won't notice. But the confusing thing for doctors is these names, and there's also D2 and D3, and the confusing thing is that diol you'd think would be the 2, but it's not. Diol is that one, and triol is that one, and D2 and D3 are something completely different. So all these could be in the form of D2 or D3. So you can go to the health food shop and get vitamin D2 or D3. If you get D2, your liver converts it to 25-hydroxyvitamin D2. So it's a bit confusing, the nomenclature. But I think as far as you guys are concerned, you don't need to worry because all you get hold of is vitamin D, and that is safe. And it doesn't really matter too much if it's D2 or D3. So what? What about... what about the children? Jill, do you remember Priscilla? She gave me this slide, and I've shown it 1,000 times. And every time the audience react to that picture, I don't know why. But what about the children? What does it mean in practice if you are short of vitamin D? Well, in adults, there's evidence coming out that vitamin D is important in many diseases. It could perhaps explain the increase in diabetes that we're seeing, some cancers possibly, osteoporosis definitely, asthma. There's a big study going on at the moment in London looking at the link between asthma and vitamin D deficiency. Multiple sclerosis, there's a clear association. People discovered that because they noticed it was much more common in Scotland, they have much more MS than in England. Then they looked across the world at all the different countries, and if you just plot how much sunshine a country gets, there's a very close correlation with MS. And then last year, people worked out how the biochemistry and the genetics of it all works, and there's clear evidence for that adult disease. In children, there's really four main diseases that a doctor like me might see. Can you shout out, what do you think, why might a child come to hospital because they're short of vitamin D? What? Rickets, thank you. Pardon? Anything else? Rickets is the classic thing. Muscle pain and weakness, absolutely, thank you very much. Wow. Anything else? Oh, right, okay. Absolutely, so cardiomyopathy, but okay, Natasha, what is cardiomyopathy? Cardiomyopathy just means a weakness. Yes, cardio is heart, and myopathy really just means muscle pain and weakness, basically. Well, not pain, but weakness. So you have a weak heart muscle. And the fourth thing, which is hypocalcemic babies. So the cardiomyopathy was a new thing. A lot of us didn't know about it until this paper was published from a few centres in London in 2008 about some children who were desperately sick with heart failure. Some of them were waiting heart transplants. And in 2008, they started to check their vitamin D levels, found they were deficient, gave them vitamin D, and they got better. And this was a dramatic turn. People like me did not know that you got heart failure from vitamin D deficiency. But we do know that now. Hypocalcemic babies is something, again, I'll show you some work that we've done, some data on that. But quickly to show you what rickets looks like. Kids with rickets don't grow very well. They're unhappy, sweaty, and weak. And it's the ends of the bones which grow, and those are the bits that get swollen. So you see it in the wrists. If it's severe, you might see it at the end of the ribs, where the bone of the rib joins the cartilage, the soft bit there, that gets swollen. But the typical place is in the knees, which bend. They could be bow-legged or knock-kneed. On an X-ray, it's much easier for doctors to recognize that that is rickets. I'll show you another X-ray to make it easier for you guys to appreciate, because this is a normal 2-year-old's wrist, and this is a wrist with rickets. And this is the bit that grows. There's a gap there with cartilage, which is where the bone grows. Once you go through puberty, that all fuses together and there wouldn't be any gap. But this is the hot end of the bone, which is important for growth. And if you don't have vitamin D, it gets all ragged and flayed and sprayed. And there's just less calcification. So you see about 6 bones in this wrist, but only about 2.5 in that wrist. Give that child vitamin D, and within a few months, the X-ray will be better. So, muscle weakness can be quite dramatic, and the health visitors amongst you might come across dramatic stories like this. This was a child, again in London. A 2-year-old Asian child was sent to hospital because the parents were concerned he wasn't walking yet, and he was slow to crawl. And he was exclusively breastfed. No vitamin supplements. They found they did a whole batch of blood tests looking for all sorts of terrible diseases. And they were very happy to find it was just vitamin D deficiency. He gave him vitamin D and he got up and walked and he's fine now. But that shouldn't happen. I was going to show a video. Just remind me, what time do I finish, Andrew?
In
15 minutes. I've got a video of a teenager. I don't think I will show it because it takes a couple of minutes. If you want, I can show you a video of a teenage girl who also presented very weak and with pain, and a pre and post video. But we'll see if there's time for that. But let me just carry on telling you a bit about other ways it can present. We've talked about rickets, muscle pain, cardiomyopathy I mentioned. I just want to say something about these hypocalcemic babies, because this again is very much in the realm of the midwife and the health visitor. This is, if you get vitamin D deficiency when you're very young, just a few weeks or a few months old, that's when you're growing the fastest. You grow again during puberty, but the growth during the first few months is the most dramatic, and you really need a good supply of calcium and vitamin D. If you're low in vitamin D, your blood calcium drops. We call that hypocalcemia. And how do you think those babies might come to hospital? What do you think might... parents don't measure the blood calcium. Yes, muscle spasms, fitting especially. They have convulsions. They could even have cardiac arrhythmias, but we don't really know about that. Perhaps it could explain some cases of sudden infant death syndrome. We don't know. There's research going on into that. If you suddenly have an arrhythmia, you just die, and there wouldn't be an easy way of telling. But if you have a convulsion, you're brought to hospital. And so my colleague Priscilla and I published a study we did, again, at the local district general hospital, Northwick Park. We just asked the lab to tell us how many infants had a low calcium level, and they found 16 customers like that. We got the hospital notes and saw that 13 of them came to hospital with convulsions, 3 had rickets. And the worrying thing for us was that some of those convulsions just seem to be what they call simple febrile convulsions, which is a common condition you will have heard of. And it's a condition that doctors are generally told not to investigate. You don't even have to send the child to hospital, certainly don't have to do blood tests. And we might be missing some of these. So we thought that was an important lesson. Have any of you ever heard of babies coming to hospital with hypocalcemic seizures due to vitamin D deficiency? No? Anybody? No? Okay, but we saw it in our hospital. It may be partly because we've got a very high-risk population. There is currently a national survey going on, so every paediatrician in the country is being asked to report if they see a case of hypocalcemic convulsions. So we will know by the end of this year, they'll publish it next year as to how common this problem is. My take on it, though, is even if it's not common, even if you have never seen one, you know, even in the country, if there's only half a dozen, it's the sort of thing that just shouldn't happen. It's so easy to prevent that.
Sorry, are these the kind of convulsions you get when you get very high temperature?
So I should have said, so that those fever fits that you're talking about are called febrile convulsions. They're very common. They're usually totally innocent. We shouldn't do anything or worry about that at all. But no, I'm saying some babies have convulsions that look like that, but they aren't. They are due to the baby having a low calcium level, and that's what we call hypocalcemic. So it might look the same. The baby just goes unconscious and shakes all over, and it's extremely scary for the parents. The parent usually thinks the child's dying. It's often the most scary thing they've witnessed in their whole life. But if it's a simple febrile convulsion, you can forget about it. If it's one of these, you really want to give the baby some vitamin D. Big question on my mind is, why has vitamin D deficiency recurred? When I trained, I qualified in 1985. I wasn't taught about any of this stuff, and we didn't see any of these things. I didn't see any children with rickets. I think I saw 1 in 10 years, and hypocalcemic seizures also. It has recurred now, and we need to just think, what has changed in the last 20 years or so? This, I think, might be we've got about 10 minutes before coffee, is that right? Yeah. So I'll just do a very quick commercial break about talking about history, what is Orthopaedics, and the Royal National Orthopaedic Hospital. That's the logo we use at the moment, but the truth is the logo used to look like this. Can anyone read what that says? Royal National Orthopaedic Hospital, and what does it say down here? Crippled children. Oh, we don't like that word crippled, do we? So we sort of, people nowadays try and sanitize it into that. But can I just ask what these words mean? What does orthopedic mean? Shout. I heard quite a lot of bones, and it's true, nowadays it means bone. So this is the bone hospital, but I heard who said straight child? Yes, why did you say that?
Because we're meant to, and Regan told me. Is it Latin?
I thought it was Greek, but I can't tell the difference. I believe it's Greek. But the point is, I know what I'm a paediatrician. That means a children's doctor. Paediatrics is children's medicine or children's doctor. And that ped is the same as that. Ortho means straight or right or correct. And that word just means straight children, as you say. So you learnt your classical languages right. And the point is, this hospital used to take children who were crippled. Crippled just means not straight. That's all it means. It's not really an insulting thing to say. I mean, you're either straight or you're not straight. And if you're crippled, that means you're not straight. And orthopaedics, when it was invented 200 years ago, was about making children straight. And they were not straight because their bones were bent because of rickets, TB, polio, and other diseases which you now prevent or treat with medicines. None of those things need orthopedic surgery. So that's a bit of history. And just to show you a bit about what our hospital, it's 100 years old, I'll flick past that. This is the children's ward. I think, Jill, you'll recognise the buildings, or that's Duke of Gloucester. Anyway, this building still exists. they used to take children out into the sun in those days. And I recently discovered, I don't know if you've seen this, Jill, but you'll remember Marilyn, one of the teachers, she gave me this picture of revolving huts. They used to have these huts on a little base that turned round. So they could put the children inside and turn it to face the sun. And sun was, around the world, sun was regarded as healthy. But we've seemed to have forgotten that. Okay, so in this day and age, we're getting rickets again. Things have, in those days, during the Second World War, there wasn't enough food in this country, but every child was given their daily vitamins, whether they liked it or not. And people used to be encouraged to go out in the sun, but now they're encouraged to cover up, and there is no sun, and kids say no, and we don't force anyone to take any vitamins. So why has it recurred? I think there are 5 reasons why we are now seeing children with rickets. The thing which troubles me the most is that, number 1, we've stopped giving our children vitamins, and I think you showed good data about that, Alison. Adults don't take vitamins, and you said most adults don't think it's important for children, and even those who do, like me, don't always give our kids vitamins. That, I think, is probably the most important. They probably go outdoors less, they're on the computer and other reasons, they probably used to spend more time outside. Immigration is a very important factor, so most of the severe cases we see are people with dark skin or people who cover themselves and don't sunbathe, which used to be part of the normal culture of most people in this country, cultural habits, and perhaps genetics, and for various reasons we have a different population. That is an important factor. And the other 2 are things that we have done. So we've told people to avoid the sun. Massive skin cancer prevention campaign. 20, 30 years ago, people didn't use much sunblock. 60 years ago, sunblock didn't exist. Now every child gets smothered. And the other one is breastfeeding. Now, we're quite right to promote breastfeeding, but if you do breastfeed, you need to think, how's the baby going to get their vitamin D? So I think those are the most important reasons, and it's all this chap's fault. There was a paediatrician called Lightwood who, after the Second World War, campaigned against vitamin supplementation. So in this country, foods were no longer fortified, whereas the rest of Europe and the States have much more generous vitamin D supplementation programs. What do we need to do about it now? Well, we need to, I think, to be aware and to accept and to pass on the message that breastfeeding is the best, but you need to think how to get vitamin D. And this is a paper that was published last year by a group in America about vitamin D supplementation during pregnancy, and they're about to publish their data on vitamin D supplementation during breastfeeding. And basically the data that they've presented verbally so far, it's not in writing, but basically they're saying if the mother takes 4,000 units a day, the breast milk will have enough vitamin D. In this country, we recommend mothers to take 400 units a day. And therefore, I would say, if a baby's breastfeeding, yes, give mother 400 units, but give the baby at least 200 units as well. I'll come on to the doses in a second. Just quickly say, doctors like me can treat a disease like rickets, that's easy. A better doctor treats the whole patient, but you guys can improve the health of the whole community and really make a difference. I wonder why that's shifted. Anyway, how do we prevent it? This is the most important thing in practice, I think. There was some guidance from NICE, which wasn't terribly helpful, I didn't think, but the Chief Medical Officer published their guidance about in 2005, in fact. Nobody took any notice, but the new Chief Medical Officer, Sally Davis, sent a letter, probably to all of you, certainly to all health visitors. I don't think the midwives were included, but GPs, every GP in the country got a letter from the Chief Medical Officer of England, who's Dame Sally Davis, and the Chief Medical Officer of Scotland, Ireland, and North and Wales. And basically, they made 2 recommendations. Unfortunately, well, paediatricians think it's unfortunate they did not say the first thing. Some of us feel that all children should get a vitamin supplement of vitamin D of say, 200 units a day from birth. But what the CMO said was that all children from 6 months to 5 years should get 300 units a day, or they put it in microgram terms. They said 7.5 to 7 to 8.5 micrograms. It's about 300 units a day. Children from 6 months to 5 years. People like me feel passionately that it's a bit late to start at 6 months. We see the hypocalcemic babies convulsing, and we see the cardiomyopathy in babies, and unless the mother's got a really good vitamin D status and has taken vitamin D in pregnancy, we would rather just start from birth. Anyway, that's a bit controversial, but this is not controversial. This is the official Department of Health guidance that all children from 6 months to 5 years should get that, as should all breastfeeding and pregnant women. The question is, how do they get it? The Department of Health hasn't said, do we tell them to go in the sun? Do we give them vitamin drops? Do we give them food supplements? And I think that's up to you to work out with your families how they want to do it. You mentioned very briefly Healthy Start. I don't know how many of you know, who knows about Healthy Start program? You've all heard of it. And you know that basically it's means tested. If you're on income support, you get a voucher of £3.10 to take to the supermarket to buy formula milk or vegetables or fruit and healthy food. But only 2% of the people who qualify for that get the vitamins that they're supposed to get with it. And these vitamins, I hardly ever see a child taking one of these Healthy Start vitamins. It's quite a good supplement. It's got 300 units of vitamin D. It's fine, but it just doesn't, people don't take it. We don't give it to them, and if we do give it to them, it sits in the cupboard, they expire, they have a short shelf life.
I was just going to say, mothers don't get the actual vitamin supplementation piece of it until the child's 6 months. So
Indeed.
Is that risk of them not getting it?
Absolutely. So midwives, for instance, you interact. There's a lot of interaction around the time of birth when you get in, but you're not supposed to do it. It's all left till 6 months. And who goes to see the family when the baby's 6 months old to tell them now you can start your vitamins? It just doesn't work. Healthy Start is recognised as a failure. But there are plenty of other ways to get babies their vitamin D. And I'll just quickly, I think I've pretty much run out of time, so I'll just quickly flash past the couple of ideas and then come back to this, because this is the most important thing I think for you to do. But quickly, there's a debate about treating rickets, what sort of dose should doctors use, but we use much bigger doses, thousands of units, and that's fine, and it's safe. In overdose, there have been cases reported of babies having millions of units of vitamin D, and they've all recovered. So don't worry about giving a child a few hundred units. Vitamin D is safe. That's an adult study. Again, if you're worried about pregnant women, we're always worried to tell pregnant women to take anything, but vitamin D is, in the doses that we're talking about, is very safe. There was some concern 2 years ago. A study was published where they gave women 500,000 units just once a year, which was a strange thing to do. It's not normal to have one dose on one day and nothing for the rest of the year. And it possibly was harmful compared to placebo, but that's controversial. Basically, I would say vitamin D is safe. So this is my last slide. I think what we all need to do is to increase awareness amongst the whole community that vitamin D is important. People need to think, where am I getting my vitamin D from? Am I eating fortified food or taking a supplement? Do I get enough sun? The high-risk families you really need to focus on. There are families who don't speak English and really don't know that you don't get enough vitamin D from a normal diet. We need to identify them and get them the correct prevention of advice, which basically has to be some form of, I've called it supplementation, or you could say fortification, but somehow we need to increase the vitamin D intake for our children. Thank you. I'll just leave my email address up there again. I'll be around for coffee, and I'm really interested if anyone has any comments or questions for me.